It's fine for us to fly in when you've fallen off the cliff and pick you up and take you into town, but what's better is to put a fence up the top so you don't fall in the first place. That's good primary healthcare and preventative healthcare.
Healthcare challenges are all about getting the right care to the right individual at the right time. Early detection in most cases is the difference between life and death.
Everyone on the planet, irrespective of where they live, can participate in healthcare equally, affordably and regularly. And both Microsoft and NVIDIA provide critical technical capabilities to realise that at the sort of scale we're talking about.
We have a moment in time today, and we have a technology that, if deployed responsibly and executed right, has the potential to reset the trajectory of human health.
The tyranny of distance, well, that's something we live with every day in our service. The distances between healthcare services and patients in this country can be up to 2,000 kilometres. So how do you bridge that gap? Here at Flying Doctors, we're caring for people in rural and remote communities where there aren't necessarily healthcare services, or the healthcare services are quite restricted. An example of what we're doing at the moment is we're putting free access telehealth services in small communities. What we haven't really seen is widespread coordinated utilisations of these things in the medical sense to not only allow for screening, but to incorporate into a healthcare service delivery that allows monitoring and management in home.
Australia's healthcare challenges are driven in part by its geography. If you think about that geography and spread, and if you just think about the fact that healthcare is delivered as a physical infrastructure, somebody needs to go somewhere to do something, to see a doctor, to get a check. It's impossible for the current healthcare system to cover all of us in a way that provides the sort of access that we need to healthcare.
The further you get from regional towns, the less and less the basic screening type services and maintenance type services are available. So the rates of unplanned hospitalisations and preventable hospitalisations in rural and remote parts of this country are about 3 times higher than the rates in the city.
We need to change our idea of what healthcare is to provide access to the broadest possible population. Is there another way we can do healthcare? Is there a way that we can make health far more convenient, certainly cheaper and more accessible, for everybody? Could we commute all the health to your phone?
Helfie is a preventative health system for early detection and prediction. We pair everyone with a personal health AI that is their constant companion, sitting on their mobile devices and continuously available and learning. Today, Helfie checks for over 20 plus health conditions through multimodal health checks. So Helfie essentially is your human health platform that is in your pocket.
The ability just to look at your phone and take a selfie, which is where the name Helfie originates from, and check all your vital indicators in a couple of seconds, recording your voice or coughing into your phone to check on respiratory conditions like COPD or croup or bronchitis or COVID or tuberculosis. For your personal context to be considered in your health is the capability that we would love for every human to be able to access, because we know that when people can get access to services like that, it makes a profound difference to their health.
For me, Helfie has a unique proposition. We're not trying to treat your problem. We're trying to find your problem before it's a problem. We're trying to use all of that information that you are gathering every day with every device we have on us and turning that into useful, predictive information. I love mountain biking. I do it on a regular and competitive level. But 18 months ago, I had a widowmaker heart attack. It was totally unexpected. That was a real eye-opener for me because I was fit, I had a low resting heart rate, I had low blood pressure. I know from my performance stats on the 6 months leading up to my heart attack that the signs were there, but they just weren't red.
Data's not active in healthcare in the way it could and should be. Data's siloed, data's hard to get, it doesn't sort of flow. It's one of the reasons I think that we have a systemic decline in life expectancy as well, is that we can't put data that we have available to active use in our healthcare. And just to give you a sense of the magnitude of that data, 30 or 40% of all the data generated on the internet today is human health data, yeah? So not selfies, not entertainment content, not all the sort of stuff that the internet is active with, but it's human health data. And that's growing exponentially with sensors and wearables. So we've got enough data to solve enormous problems in healthcare.
When we think of the data that we capture from a user, that comes from different modalities. It comes from the data the user gives Helfie. It comes from the data that are coming from image analysis or your document analysis. It also comes from many different angles like the tone of your voice, the things that you have been journaling in Helfie. We have the full profile of the user that we manage, which has your medical history and where you're coming from, your culture, your ethnic background, and it's used to give like an insightful output for the user. Now imagine this for the entire world. That's a lot of computation power that we need.
Leveraging Microsoft and NVIDIA technology helps us build smarter models, more scalable models, better inference pathways.
Helfie is currently using Azure machine learning as its primary production inference mechanism. The same infrastructure supports high throughput, low latency, serving large multimodal models. NVIDIA H100s on Azure's higher compute density and memory bandwidth significantly reduce our training time, cutting what was taking multiples of hours down to approximately an hour, which means we could train full models in under 24 hours rather than 48 to 72. That really, really helps us with our ability to iterate on ideas. One of the advantages for us of being on the Azure stack is that we have a global presence. We can put the compute where we need it. We're not talking to an LLM with general knowledge. We're talking to and creating inference around your specific data and what matters to you and the next things you need to do. And that needs to be fluid. And the only way that that's going to be fluid is to be able to run it globally, get information as close to the user as possible and act on that information.
We're living in a world where we hear about cyber threats every day, and healthcare is one of the biggest targets for acquiring and then extorting companies around patients' personal data. Humanity right now is rightly concerned about who has access to their data and how it can be used against them. Examples with healthcare would be, say, well, my insurance premium might go up if you know that my whole family had heart attacks when they were 40. Or I might not get insurance because you know that. And that's a very, very slippery and dangerous slope for us to go down. And trust in healthcare is everything. If you don't have that, people won't engage. And if people don't engage, then you've failed. You can have the best model of care and the best tech. If people don't trust it, they won't use it.
We take every possible opportunity to secure health data. And we do that by using enterprise-grade infrastructure on the Microsoft Azure stack. This is infrastructure that is utilised by governments and regulators and healthcare systems globally. We have an entire AOps team that puts AI guardrails around how the AI utilises data and what data the AI is allowed to get access to. And all of this is based on our relationship with this incredible infrastructure that we are on, being Azure, whereby we're able to deploy data privacy by design on that stack. We only capture what we need to capture in terms of data use. So we will only save the data that is absolutely critical to provide the hyper-personalization that we promise. So this data belongs to the end user. It is never marketed, it's never harvested. It's always working for the end user's health benefits.
I've always had a passion for trying to understand how infections in a population can be controlled. So I began as an infectious disease physician. I did a PhD in epidemiology. I worked in vaccination and healthcare, and for the last 25 years, I've been the director of Melbourne Sexual Health. So we had wondered for a while whether or not you could use key questions from individuals and show them images and ask them whether their condition looked like this or not, and provide an accurate answer then without any input from a doctor. Having done the academic work, we went looking for someone who could commercialise this and had a vision for what this sort of AI healthcare might look like. And Helfie was the organisation that found us, and we found them at the same sort of time. So the way the Helfie app works is an individual goes onto the app concerned they have a sexually transmitted infection, they've got symptoms, and they will then answer the same questions that a sexual health physician like myself would ask them in the clinic. They then will look at different images and they'll tell us whether it's exactly like that or not like that. And then they might upload an image that they've got and the AI program will analyse that as well. As part of their experience on the app, they essentially get a clinical consultation, and at the end of it, without having to take their clothes off, without having to tell a doctor intimate details about their life, if healthcare is more accessible, more people get treated. The reason it's more accessible is, firstly, you can do it online. The second thing it does is it makes it less expensive, because the use of AI in healthcare will shorten the duration of a consultation.
Healthcare's a significant cost to any country. Most countries in the Western world spend between 8 and up to 17% of their GDP on healthcare. And that is clearly not enough. A lot of people do without. There's a lot of cost in providing infrastructure, personnel, R&D, and then therapies. The ability to fund that for everyone, everywhere, all the time is limited by any country.
If I was to give you an example on skin cancer rates here in Australia, 2 out of 3 Australians will have a skin cancer diagnosis in their lifetime. And unfortunately, we still see around 2,000 deaths a year. But we know that with early prevention and early detection, the survival rate is over 95%. Imagine this. What if you could screen every adult Australian, 20 million plus people, from their sofas in their homes for under 25 cents at a cost of $5 million. And through that program, you're able to get instant feedback on some of the earliest signs of this horrendous disease. Now, with the Australian government spending almost $2 billion on this condition alone, you'd think a $5 million screening program that you might even run every quarter if you wanted would be a really great use of money. Not only would it save lives, but also it would have an incredible economic impact. Think about broader conditions, cardiovascular disease, hypertension, stroke, other types of cancers, and the equation just simply multiplies.
So the benefits of treating people with AI are huge, beyond the fact that you've just stopped a doctor having to go to them or them having to go to a doctor. I think that's where we are heading. Healthcare at the time and place where the patient is at their need and discretion, not built around the old structures of 9-to-5 outpatient services and hospitals in certain locations. And that's the challenge. And that's a really exciting challenge.
Too often, access to healthcare is governed by where you live. People deserve the same level of healthcare wherever they are.
Our mission at Helfie is to reset the trajectory of human health for all 8 billion humans on this planet by building the world's first human health network.
By building a system that can be truly accessed by all humans, the hope is that we make it possible for all of us not just to participate in healthcare, but have health outcomes and an impact on our health that's early and positive and makes a difference to the way we all live. This is the first time we've been able to do something like this. This is the first time that humans and humanity has been able to design a system for all of us.
In our world, almost everyone is a Helfie user. We have a saying, most of the things you're doing in day-to-day life, you're halfway to a Helfie.